Okay, so it took me about a year to find an oral surgeon to take out my wisdom teeth. And in fact, I failed. So I'd made about 60 calls or more, and none of them would touch me because I had EDS and they didn't want to dislocate my jaw. And not a single one of the doctors that I contacted would talk to me. And I got their assistants, and generally what I got was, well, they said it's like high risk, so like you'd have to go to the hospital, and like we don't take your health insurance, so like you'd have to pay for it out of pocket. I was like, a whole year of that. So my mother-in-law happened to find somebody. Um, her friend worked with a guy who, yeah, I don't even know what to say about him. Um, he looks like a mad scientist. He's no delicate fellow, but he's just the best out there. Um, the first thing he did when I called his office was pick up the phone, and he picked up, and I asked him, "Do you deal with patients who have Ehlers-Danlos syndrome? I need to get my wisdom teeth out. No one will touch me." And he was like, "Yeah, why will nobody touch you?" And I said, "Because I don't want to dislocate my jaw." And he was like, "So what? We'll just put it back in." Oh, perfect. Okay. So my mother-in-law actually arranged for her friend to hold my jaw stable the entire time. She said that she had done that several times before working with this oral surgeon, and so for the entire hour, all she did was stabilize. Um, Wonderful. But that's not all. So the surgery ends, and I go home, and I take care of my teeth, and I look like John Goodman because I'm all swollen. And about a week and a half later, I start getting this excruciating pain on one side. They had to section one of the teeth, and I guess it's fine, but um, my face is not happy about that. So I called the surgeon, and he says, "Well, try this, try that, try the other thing, try heat, try ice, and try this, pain meds, whatever." And I said, "I tried all that, it didn't work." And he said, "Go get some Bengay." I said, "I use BioFreeze." And he said, "Oh, that's the best out there." And I said, "Yes, but it's not doing the job." And so he said, "Okay, come on in." I know it's an hour drive to this guy's office, but this is the best. I know that if I drive there, I'm not going to leave without a solution. And when I got there, I got more than I bargained for. So he walks in to the office, and he's like, "What are you doing here? What are you complaining about?" Funny guy, real nice guy. And I said, "Oh, I got pains." And I explained to him where the pain was, and he just before I knew what was going on, he numbed a part of my jaw with Novocaine, and that solved part of it. But up until then, I had just been caulking my mouth with Oragel to bring the inflammation down, and then packing my whole head in ice. And it didn't do it. So we talked about a different kind of medication, and he suggested a muscle relaxer. He identified that it was a muscle spasm, which is pretty common with EDS and injuries, and um, he suggested a muscle relaxer. But the problem is, if I take those, then everything is lax, and I can't function. I can't even get out of bed to brush my teeth in the morning. So he told me to try the painkillers he prescribed, but they made me sick as a dog and crazy and miserable. Oh, and so we said an anti-inflammatory, but I already take one. I don't like taking medicine. That's why I use BioFreeze. That's why I use topical things and all the right splints that I'm supposed to be wearing, because I don't like to take medication. I don't like how it makes me feel inside, and I don't like the cost. I would rather make the investment in all the right splints and know that somebody's keeping an eye out. And anyway, so he goes through muscle relaxers, painkillers, injections, nerve blocks. He pulls out a chart and says, "Where's the pain?" And I trace it. And he pulls out another chart and shows me different muscles and, things that I'd already seen before, but had never quite discussed with anybody. So, um, facial anatomy is not something that I'm too familiar with. And I don't know, I just haven't needed to know it until now, until this explosion. And so he suggested using heat to relax it. And I said, no, heat does not work for me. It hurts more. So I told him ice feels better. I said, I wish I could just mummify my head, something to hold my jaw shut forever and ever, amen, so that it didn't hurt anymore. And I told him that I had tried a night guard for people who grind their teeth. And he asked me what it does for me. So I told him the bottom rim kind of holds my bottom teeth in place, and it just feels like I have something to bite down on and something to stabilize this joint, which keeps popping when I close my mouth. And I imagine that'll go away, but it'll be a few months. Took the guy 20 minutes to a half hour, just going back and forth with ideas and constant rejections and fighting from me, and not fighting, but just challenging his suggestions. Most doctors and physicians would be furious and frustrated, get short, get nasty, downright forceful. I've had that happen enough times, and so have many of us. But this guy took all the time that I needed to make sure that I was confident with the solution he was proposing. Not only, but he gave me a list of ideas, treated me with respect, let me choose what I wanted, took the path that was the least invasive first, and gave me a path of escalation in case the least invasive didn't work. So I had every option available, and I chose one that I think works for me. So we'll see what happens. But I'm frustrated because people told me that this would be just a few days of discomfort, and it's turned out to be 2 weeks of a nightmare. Just crazy amounts of pain, being slower, thinking more slowly, and being generally frustrated. And that's not all that's going on, so it makes a difference in times like this to have a doctor care. So, to all you doctors out there who may be watching, thank you very, very much. If you are the kind of doctor who pays attention to patients, um, I know that not all patients are as studious as I am and don't go in to an appointment quite so armed, but that's what makes a difference, because when I know that a physician takes time with me to have those kinds of discussions, I know they're doing that for other people too who don't have the academic faculties to have those conversations. So I appreciate that. And for all the people with EDS who say, well, my physician doesn't understand, find a new physician. Just move on. No insurance carrier that I know of forces you to stay with one doctor. If they're not working out and you're not able to establish a level of communication that is therapeutic for you or beneficial, then what are you doing there? Move on. I know it's hard, but it's harder to stagnate. Just my 2 cents. Take care.